We live in a world where we are constantly getting mixed signals on what the best practice for diet is. And the problem is that people keep trying to treat it as if it's a one size fits all thing. But we all have various different health needs, genetics, ancestry, and all of that will play into what is the best diet for us. So, to be quite frank, I find this conversation of the best diet for everyone to be a little bit silly because we are all individuals and we will not respond the same way to each individual diet. Now, this then begs the question, how do you figure out what the best diet is for you as an individual? Now, of course, you can figure out a lot by just taking a really deep, thorough health history, understanding someone's health goals. But another way we can really narrow in on what you need as an individual is testing. So today, I want to talk to you about food sensitivity testing. There are loads of different tests that I can use to guide what someone needs, and food sensitivity testing is certainly one of them. Now, it's not to say it doesn't have its share of controversy, and that is exactly what I'm going to go over today. How useful is this test? What are the pros and cons of this test? And do you think that it's the right test to help you narrow in on your unique individual diet needs? My name is Dr. Robin Lewis. I'm a naturopathic physician practicing here in Vancouver, British Columbia, Canada. And today let's talk about food sensitivity testing. Now, of course, first I should clarify for you what type of food sensitivity testing that I'm talking about, because a lot of different methods will say they're useful for assessing food sensitivities. And today I'm talking about a very specific type of testing, and that is blood testing, where you measure something called IgG, which is an immunoglobulin. So essentially, in reaction to certain foods, your immune system will mount a reaction and produce a lot of IgG immunoglobulins that will bind to the antigen, which is the food itself. So you're measuring that reaction. How much IgG is produced in reaction to the food, and that will tell you, roughly speaking, how much inflammation that food will create inside of your body. So foods that very drastically elevate your IgG are foods that you're going to want to avoid in this context, according to this theory. Now, these IgG food antigen complexes that are created are usually removed from the body through your other immune cells called macrophages. But the problem is if you're continuing to eat these foods, and especially if you eat them in high quantities, the macrophages can't keep up. And it's when these complexes can't get cleared anymore, then they start to create inflammation. So that's one aspect of food sensitivity testing that can get a little confusing for some people, because there does appear to be a bit of a threshold effect where you can get away with some of it depending on how severely you react to that food. And it's only if you're eating it more regularly that you might start to see it translate into symptoms. And those symptoms can be very broad because inflammation can affect a lot of various different aspects of our health. If we look at the gut specifically, these complexes can create a leaky gut situation if they're left to be high enough for long enough. And so this leaky gut is exactly how it sounds. The integrity of your gut isn't great, and then that in of itself can further perpetuate the reactions because you've lost the integrity of your gut barrier. And why that's a problem is because that barrier usually should prevent food from getting in until it's fully broken down into its smallest components through the actions of your digestion. When the gut is leaky, things can get in when they're not completely broken down, and then this can confuse your immune system, creating more IgG reactions. So it can have a bit of a cyclical effect. And so again, this is just one of the mechanisms that we're trying to capture in the food sensitivity testing. The other really interesting thing about food sensitivities that can make it incredibly hard to figure out on your own is that they can have a delayed reaction. So this food can create a symptom hours after the consumed food or days. So up to 72 hours later, you can feel the effects of that food. So say your food sensitivity gives you a headache. It could be what you just ate that created the headache, what you ate yesterday, what you ate the day before. It can have a compounding effect. So as you can see, it can be very hard to pinpoint these things on your own because the reaction isn't immediate. And this is a big reason why food sensitivities are not to be confused with food allergies. Food allergies are very immediate, so they usually kick off within 15 minutes of consuming that food, and the symptoms are often a lot more severe and potentially life-threatening. So you can think of a peanut allergy as a very good example of this. You eat the peanut, you get an immediate reaction, and in some individuals that can be really severe things like your throat closing off, hives all over your body. It's usually not subtle. And so food allergies are testing something called IgE. So both food sensitivities and allergies, they are an immune reaction, but an allergy is an IgE reaction and a food sensitivity is an IgG reaction. And so those two are measured different ways. And again, allergies are a little easier to figure out because the reaction is right away. Whereas unfortunately, food sensitivities are a little bit more subtle. They can have a delayed reaction and they can create inflammation that is low grade and leads to a lot of different symptoms. So some areas that can get affected by IgG that have been studied are gastric upset. So of course, these food sensitivities can give you a lot of gut symptoms like bloating, diarrhea, things like that. They can also lead to things like headaches and migraines. A lot of atopic diseases, so this is things like eczema and allergies. They can create a lot of inflammation that leads to things like joint pain and muscle aches, fatigue and brain fog. It can also contribute to low mood and anxiety because a lot of our neurotransmitters are made in the gut. Elevated IgG has also been linked to things like obesity and flaring of autoimmune conditions or inflammatory conditions. Now, of course, if you have a lot of these conditions, it would be very helpful to take a whole body approach. So it's not like I'm just doing food sensitivity testing in someone with an autoimmune condition, but it can be a helpful piece of the puzzle, especially because we consume a lot of food on a day-to-day basis. So we want to make sure that food is helping us thrive and heal and not putting us backwards. And of course, if something is creating a lot of inflammation, that's inflammation your body has to deal with. And if you really want to focus on feeling better, removing the obstacles, so removing inflammatory foods in the diet that are unique to you, can be incredibly helpful. Let's start by looking at IBS, irritable bowel syndrome, which is an interesting diagnosis in of itself because it's actually just labeling a cluster of symptoms and it tells you nothing about the cause of your symptoms. And so I, will refrain from my rant on that diagnosis. But either way, of course, a lot of people have been diagnosed with irritable bowel syndrome. And in my experience, it can be caused by a wide variety of things. So it can be related to microbiome issues like SIBO, really weak digestion created by really poor sleep, anxiety, things like that. And yes, food sensitivities can certainly be one part of that IBS equation. So some people do get IBS symptoms in relation to these food sensitivities. So when they looked at this and they studied the population of people with IBS, they found that 26% of those people who followed the elimination diet for 12 weeks got improvement in their symptoms. And so 26% might not sound like a lot, but if you think about the fact that IBS is caused by a variety of different things, I think 26% is pretty darn good because that's saying for that percentage of people who do have food sensitivities as a causative factor for their IBS, they will improve with the elimination of these foods. And in my practice, I do a lot more than just eliminating the foods. You can add things to help speed up the recovery of the gut and address it from a multifactorial standpoint. But this is looking at just simply removing these IgG elevated foods. So that's pretty cool to me. Another really interesting study looked at atopic disease in children. So think asthma, eczema, seasonal allergies. And they found that approximately 70% of them had a food sensitivity to eggs and milk alone. Now, these panels were not comprehensive, but it's super interesting because these conditions are more typically associated with elevations in IgE. But it appears if you also burden the body with too many of these IgG antigen complexes, it makes things worse. And I have noticed this in practice, that especially with kids, for whatever reason, these foods can really create a worsening of asthma and eczema. And when you remove those foods from the diet and do a couple other immune supportive therapies, the kids respond really, really well to it. So that's another very cool use of food sensitivity testing that is outside of the gut. So it's talking about, lungs and skin reactions and things like that, which we don't typically associate as strongly with diet versus things that happen in the gut. So that one's really cool. If we circle back to actual gut conditions, they've also looked at food sensitivities in relation to IBD, so irritable bowel disease. These are much more severe gut conditions relative to something like IBS, and it's associated with specific conditions like ulcerative colitis and Crohn's. And so these are autoimmune conditions of the gut that lead to things like really severe abdominal pain, diarrhea, blood in your stools, so a little bit further on the spectrum of gut issues. And so when they looked at this, they found that approximately 57% of the colitis patients had elevated IgG reactions, and 90% of the Crohn's patients had them, and about 42% of the healthy controls also had them. But as you can see, the people with IBD, so Crohn's and colitis, had higher amounts of it. And so when they removed the foods again, they noticed improvement in symptoms, not only to their gut symptoms, although that was the most dramatic, so things like diarrhea, cramping, blood in the stool, but they also noticed improvements to the things that happen outside of the gut. So a lot of these people will feel extremely tired, get joint pain, and a lot of outside of the gut reactions to their autoimmune condition, and the food sensitivity removal can also help alleviate a bit of that as well. And as I mentioned earlier, the food sensitivity testing and elimination of those food sensitivities, at least temporarily, can be helpful for a wide variety of other conditions like headache and migraines and obesity. And there are a small amount of studies to support that. Of course, in general, there are not nearly enough studies on food sensitivity testing as a whole. So some of these other conditions that could potentially have benefit from the elimination of these foods haven't really been studied yet. So these are the ones that at least have a little bit of literature on it in humans that seem to be very promising. I use it a lot clinically in practice and get really good results. And I've also used it personally for my own gut health issues. And so I do really think this test is useful, but like any test, there are limitations. So let's dive into some of the criticisms of this test so you can be fully informed if you want to go to your doctor and get a food sensitivity test. There are definitely some people who can't get the test. A big reason, probably the number one reason you would not be a good candidate for this test is if you're immunocompromised or immunodeficient. So more often, I'm talking about being on medications that suppress your immune system. So in the case of really bad autoimmune conditions or inflammatory conditions where they're taking medication to suppress their immune system, you will not mount a reaction that is measurable on this test. So your immune system's suppressed, so you can't increase your IgG in reaction to food. That process is being limited by the medication. And so in these scenarios, they will show up with no food sensitivities because there is no way for your body to mount that reaction and therefore no way to measure it. You can also see immunodeficiencies happen in the context of like really severe protein deficiencies or someone who is very, very critically ill. But if we're not talking about that population, it's people who are on immunosuppressive therapies. And as I've mentioned earlier in this video, there are some nuances to interpreting this. It is really not as simple as just do the test, eliminate those foods, and you're good to go. Because as I mentioned earlier, in the context of leaky gut, especially really severe leaky gut, you don't see this in like low-grade inflammation. It's typically in really severe cases where people will react to a lot of foods because the food is getting in before it's fully broken down, confusing your immune system, and now you're reacting to everything. So those aren't actually considered like true food sensitivities. So without diving down that rabbit hole, that's a limitation to the test as well. If the integrity of your gut is really, really bad, if you're in a flare of an autoimmune condition like IBD, maybe hold off to run the test when things have calmed down a little bit, because likely less foods will show up and it'll be a more accurate reflection of what's truly going on. So yeah, the two big areas are you able to mount an IgG reaction? Are you immunocompromised? Do you have a genetic condition where you don't produce those immunoglobulins? Is there a reason to believe you wouldn't mount an immune system reaction that is measurable? Not the test for you. If you're in the middle of a really severe flare of symptoms, say like blood in the diarrhea sort of situation, then maybe hold off until things have calmed down to do the testing so that you can get the most out of it. Those are the two big ones that I'm looking for when someone asks for a food sensitivity test. Now, if we dive into specific criticisms, I find it very interesting. They'll mention that food sensitivity testing only really looks at the tolerance of foods and it doesn't predict future food reactions. Now, I would agree and disagree. Yes, it does measure how well you tolerate foods. These things can behave on a bit of a spectrum, meaning that if you eat a lot of them, they are more likely to create a reaction inside of the body. And it is hard to pinpoint the future reaction because it's not immediate, but there is a reaction inside of the body. It does mount an immunoglobulin reaction and can lead to inflammation if that gets out of control. Your macrophages can't deal with it anymore, and then it starts to perpetuate the problem. So like I mentioned earlier, it's not the same thing as a food allergy. The reaction isn't immediate. So when these critics mention that there is no food reaction, I think that comes from a place of not really understanding how this test works. And to be honest, a lot of the criticisms come from a place of just not really understanding. The delayed reactions are hard to pinpoint, but they do count as a reaction to food. Another common criticism of the test is if you do the test and a bunch of foods pop up, then it's gonna make your diet super restrictive, reduce your quality of life, and you probably will be malnourished because you're removing all these great foods from your diet, which is a very interesting criticism because sure, in some contexts, like I mentioned earlier, where you have very severe leaky gut, you can show up for a lot of things, but a trained practitioner will know what to do with that information and hopefully not get you to actually remove half of the things in your diet. So that criticism only applies to a very specific type of test in a very specific individual. And then on the flip side of that is, yeah, sure, you might restrict some foods. who wants to eat foods that make you feel bad? To me, that is like a level of restriction that I'm okay with. If this food creates inflammation in my body and I have to restrict it and find alternative food options for that particular thing, I don't really see what the problem is. What I find the test especially helpful for is not unnecessarily removing foods because you read on the internet that it's bad for you. So I actually find that these tests will often give people a lot more freedom in their diet because it's taking a lot of the guesswork out. It's not just like, oh, nobody should ever eat gluten again and nobody should ever eat dairy again. It's like, no, how do you react to those specific foods? They are common food allergens, but that does not mean every single human has a food sensitivity to those things. So in that context, I find it a very weak argument because I think that if you use it inappropriately, it can lead to these situations, but if you use it appropriately, it's incredibly helpful information. So yes, there are limitations to the test and there's ways to use it incorrectly, but overall, I find it a very helpful tool in my practice. And I find a lot of my patients really love having this information. And if you implement it correctly, it can make a huge difference for people's health. So I know this episode is short and there's always more that I could talk about. So if there are clarifying questions you have, please comment them below. And thank you again for listening.